notes in court if possible. Well, if possible, because my daughter actually opened up, and the therapist backed up and was like, well, no, my person said I can't do that. And I was like, well, can you please give me, information on that? And she was just like, well, if, she was going back and forth, and bottom line, if your daughter says I can't, then I can't. And I was like, what? But it's just going back and forth. And then I see my child when she goes to a new therapist, it's just like scratching a healed wound again. Basically, she's going to bleed all over again. It's not fully healed in there. So she does have some setbacks as far as medication. I only give it to her when she goes to school, because it basically, in a way, helps her, and I've seen it. And I don't like medication. Like, I like to do things naturally. So with that, I like when she's on the weekend, or we're on break. They're on break right now, so she hasn't had it at all. So I limit, especially how many times she has this. But I do want to go back to the comprehension. What was that again?
Comprehensive psychological evaluation.
I think she has had.
Now, I'm speaking of a clinical one. I'm not speaking of one in the school, Queen. That's a psychoeducational in the school. We're speaking of clinically outside of the school.
Yes, sir. And I think she had one done with Child Safe.
How long ago?
So that was probably a year and a half ago.
Okay, that's kind of outdated now. She needs a current one.
Yes, sir. Okay.
She needs a current one. Now, as far as the school goes, okay, your daughter, right now, the only diagnosis she has clinically is ADHD. That's it?
Correct. Yes, sir.
And in the school, does she have an IEP?
I need to go back on IEP, but I know we met for a 504.
Okay, she has a 504 for what disabling condition? The ADHD or something else?
ADHD.
Okay, does she have a one-to-one aid?
No, sir, she does not.
Does she need one?
Yes, as far as the 101 aid, can you break down what they do with the 101 aid?
The job of the one-to-one aid is to help keep the child focused, so she's not being touched, not touching anyone else, kind of be like a personal assistant throughout the school day, mostly helping her to control her behavior.
No, sir. The teacher has worked with me. She did pull her closer by the desk, and the teacher is mostly multitasking in the class.
So time out. She does have the aid or she don't?
She does not.
Okay, so that means you need to request another 504 meeting and officially request the one-to-one aid. That is, the 504 plan is an accommodation plan that a child with a disabling condition gets when they need accommodations to function successfully in school. So I'm glad she don't have an IEP unless you think she got learning problems. If she ain't got no learning problems, she shouldn't have an IEP. She got the 504 for accommodations for the ADHD, which is fine. But I believe she needs a one-to-one aid because you're saying they're talking about her hitting other people, right?
Yes, that's at her previous school. And then we had a situation last year. But as far as like the grades, I'm going to have to check for the 504. But her grades isn't doing good. Like from this, and I have seen from this, she will not focus on her lesson. Basically, I've seen my child at home as well, where she gets mad, she gets frustrated because she can't take anything in, she doesn't understand. She takes it pretty rough, and then she doesn't do her work. And in school, she would just be there, act out. Of course, they say be defiant. She tried to run away with her teacher from her teachers about a year and a half ago. But now the teacher is working with her. Her grades are still low. For instance, she has a grade of 27 out of 100 on her progress report. And with me, I'm very much about education. My 13-year-old honor roll student. But at the same time, ever since the sexual trauma, it's been an issue as far as grades.
Okay. What she needs most at this moment is a comprehensive clinical psychological evaluation, so we know exactly what's going on with your daughter, because I kind of feel like I'm in the dark because I don't know to what extent she's been damaged, hurt, in order to effectively determine what her needs are. I would tread lightly on the IEP because here's the thing. If she's not producing academically because she's going through the trauma versus not being able to do the work, those are two different things. In other words, I know kids who can do the work, but they're not producing because of their trauma. For me, that's not special ed because they can do the work. They're just not doing it because they're going through something right now. So I would tread lightly with the IEP. I don't think I'll put her in special ed. I keep the 504. Now, one thing that might have to be considered, if we needed to, but we probably need to talk before you decide to do this. If you did go special ed, you might go special ed for that new diagnosis that's going to come from that comprehensive clinical eval, meaning post-traumatic stress disorder, right? That'll fall under special ed as a other health impairment. That's OHI, other health impairment for post-traumatic stress disorder, hypothetically. So then she might require a partial day or full-time hospitalization program that the school would have to pay for, in which case she would probably need to be special ed to get that paid for. You feel me?
Yes.
So, if it comes to something like that where she's going to need a day treatment program, I mean, it could also come from the mental health system. But if it comes through the school and they got to pay for it, then they're probably going to need her to be in special ed in order to get all of that paid for. But right now, she just needs a good eval and some good therapy. And you said she was already in therapy?
Yes, sir. She's been in therapy for trauma, had to stop that and go behavior. And then she's on a waiting list. She's on 3 different waiting lists. And she's been on there for about 3 months.
That's too long. I just sent you some links.
Yes, sir, I received.
And I want you to follow them up. But what she needs most, let me see something.
And while you're looking that up, what is OHI?
Other health impairment. That's any medical or psychological problem that affects a child's ability to learn in school.
Yes, sir. I do have another some information to throw in there. So I discussed, because I did not want my child in special ed because I know that's a delay. But the teacher and I discussed, and she was like, your daughter, she can get the information, it's just retaining it. Basically, everything that she was saying, I see it at home. It's just retaining the information. I do believe that, going through certain things, you start forgetting. It's that long-term thought process is an issue with her. So I'm trying to just understand and read up on as much information as I can. They do see her academically, like she's able to do it. However, she's just not producing, and we're just trying to work together to figure out and get it together where she is having that information.
Okay. Check this out. It appears that the Association of Black Psychologists have a chapter in San Antonio.
Oh, wonderful.
What is University of Texas, San Antonio? Okay. The University of Texas, San Antonio has an Association of Black Psychologists chapter. It could be a student chapter, right?
Yes,
but
sir.
I just text you the email. So I want you to email them and tell them you need a licensed black psychologist in San Antonio to evaluate your daughter immediately. Email them. You might even want to call the school and speak with someone who's a member of the Association of Black Psychologists at the University of Texas, St. Anne. But I just text that to you. Hopefully, there's a black psychologist on that faculty who can do your daughter's evaluation. If they can't, ask them to refer you to someone. But there is a chapter on that campus. And again, it's normally a student chapter, but every college has a psychology department. And so there has to be some black psychologists there. And I'm pretty sure it was a black psychologist who serves as the faculty advisor for this campus chapter of the Black Psychologists. So that sounds like a pretty good lead right there.
That'll be great. Thank you so much.
And I want you to keep me posted. You got my number, so just keep me posted. If you need me to call you, because this is a very sensitive and urgent situation you're dealing with. So when you need me, just call me and I'll call you.
Wonderful. Thank you so much, and many more blessings to you and everything that you do for our community. I truly appreciate you.
Thank you, Quaid, and be blessed.
Thank you.
All right now. Peace and love. Wow, we had some heavy ones today, boy. Woo! Woo! Today's call, boy, was a heavy one. We didn't get the regulars today. Today was heavy. Mostly mothers, heavy cases, sex abuse, black boys with anger. FDMG update, FDMG update, FDMG update. The plumbers are insulating the pipes right now. As soon as they're done, we put the drop ceiling tracks back up. I'm going to order the paint. I'm looking for a FDMG donors only paint day. I'm looking at an FDMG invitation only, donors only paint day. Okay. I'm looking at an FDMG donors invitation only paint day. And I'm looking at making that paint day next month or January. There's going to be a paint day next month or January. I'm going to invite about 30 folks. If you are a donor, a regular donor, and you want to be on the paint day, just text me how much you've donated, your name and your city. We got to give the school a new paint look. Once we give the school a new paint look, we can get the tiles done. We can get the tiles done. And we're going to go from there. I do not celebrate Thanksgiving. I don't celebrate the genocide of any people. I won't celebrate the genocide of any people. You want to work at the school, send your resume, fdmgresumes@gmail.com. If you haven't donated to the school, your resume will not be reviewed. If you haven't donated to the school, your resume will not be reviewed. Norwood, Massachusetts, Thursday, 6 to 9. Omaha, Nebraska, Saturday, 3 to 7. Kansas City, Missouri, Sunday, 3 to 7. If you need the flyer, hit me up. HBCU PWI Black History Month requests. You better get on the list before it's too late. HBCU PWI Black History Month requests. You need to get on the list before it's too late. College professors at HBCUs and PWIs. If you want a special guest lecture from Dr. Umar, I am available. College professors at HBCUs and PWIs. If you want a special guest lecture for one of your classes, hit me up for that. Graduation speeches, commencement speeches, banquet keynotes. Hit me up for that. Lecture requests, podcast interview requests. Hit me up for that. Prisons, halfway house seminars, juvenile detention center seminars. Hit me up for that. 215-989-9858. 215-989-9858. This is your brother King Kong. Donate $FDMG School. $FDMG School. PayPal.me/FDMG Academy. PayPal.me/FDMG Academy. Peace and Pan-Africanism.